Well, here at Public Health, we really serve as the starting point with the Somali community members, particularly when they arrive as a refugee, a new refugee. The first stop is generally in Public Health. So our job then is to help connect them with the appropriate resources within the community. We want to get them connected with a medical provider because we want to assure that they get their initial refugee health exam completed as soon as possible, preferably within the first 90 days that they're here. We also meet with the refugees to help get their initial screening and immunizations started to make sure that they're continue to be healthy. So we will do screening, TB screening, and we will assess what immunizations they have already had, and then we will set up an appointment for them to visit with us and get the appropriate immunizations that they need, and then continue with the follow-up on that. We're also going to help connect them with medical resources in the community in terms of insurance. Health insurance will help get them started on that path to get coverage for their health care.
Community Health Services was formerly known as Migrant Health Services. We are a nonprofit organization that serves the health needs of the community based on a sliding fee scale. So some services we offer here are chronic disease management, acute care. We do immunizations for children and adults. We offer teen and child checkups. We do cancer screenings. And during our summer months, we offer summer mobile unit that goes out into the community that provide also these services. So, patients that have come in, we've been able to provide these services at a very affordable price. Not just that, I think that we meet the patient as a whole. We're not just, helping them health-wise, but, we'll try to find every avenue possible to make sure that they get the best care possible. Even if it's us calling out in other resources, trying to get financial assistance, food, whatever it is, we take pride in everything that we do for our patients.
So Woodland Centers is a private nonprofit, and we are a community mental health center. So we provide mental health services throughout all of our 6 counties, soon to be 7 counties that we provide mental health services in. So we have a pretty big impact on the mental health of this area, as well as some of the physical health needs, because we do have behavioral health homes, which helps people to also coordinate and collaborate with their behavior, with their mental health and physical health in combination. So our big impact on our community here is really trying to provide for the mental health needs in all of our communities and really collaborate with all of the other care providers that are available. So Woodland Centers offers an entire continuum of care, from peer support specialists all the way to a residential level of care in our youth and adult crisis, and everything in between, whether it's simple outpatient psychiatry or therapy services, in-home services for youth or families, to detox and crisis. We also offer collaborative care for behavioral health home services. We have ACT services, which are intensive services for people that have severe and persistent mental illness. So depending on the level of need, we can be as little as a peer support specialist all the way to a residential level of care for crisis. The takeaway that we want clients to have when they come here is that this is a welcoming, safe environment, that they can receive the care that they need, and we will accept anybody that walks through our door, regardless of their ability to pay, regardless of what their needs are. We will meet with them and determine how we can best meet their needs.